So now we're treating the adductor muscles with the client lying on her side. I'm using a big bolster so that when I'm going to treat the abductors, the knee is supported, as I explained in setting someone up for side lying. So nice thick bolster underneath. And what we see is this is a really common thing that folks do when they get side lying, is that they start to roll that top hip forward. And then what that does with the back foot is that you'll see that that heel starts to point up toward the ceiling almost. And that just means that the person's rolled a little bit too far. So what I will often do is just ask my client, roll that hip back and then bend this bottom knee a little. And just that little bit of bending in the knee helps to align the person a little bit better, and it helps them to keep their hips stacked. That is really helpful for setting them up in the proper position for treating those adductors. So we're treating the bottom thigh adductors. And adductors, super, often super tender. Now, we can treat adductor longus, adductor brevis, and gracilis with the client lying face up, but we can't really treat adductor magnus with the client lying face up. So, and here we can feel that gracilis tendon real thick up at the top. And it can feel nice to just compress straight down through that tendon. Kind of hook it straight down through that tendon. And just take a couple breaths. Okay, so now we're going to do a little release in the adductor longus and adductor brevis. And so again, these, the gracilis tends toward, it kind of goes slightly forward and up to the pubic bone. So we want to make sure that client rolls that top hip back a little bit so that we have access to those tissues. And then we find, oh, here's that edge of the gracilis tendon. And when the client is side lying, I tend to go slightly in front of or even through the gracilis tendon to get to that adductor longus and brevis. And that's something you can explore if you trap right through the gracilis tendon. A little less, thank you. And so our first spot is adductor brevis. And just a couple inches down from the pelvis, down from the pubic bone. For this one, I'm going, because of the orientation of the thigh, I need to go kind of right through that gracilis tendon to get to the adductor brevis. And does that feel a little better now? Feels a little bit softer. So I'm just going to slide down a little bit. And I'm going to sink in, yeah, and there's our adductor longus, the second one. Adductor longus, adductor brevis, those points tend to be right next to each other. Adductor longus is more superficial, tends to kind of show up a little quicker. And I'm going right through the gracilis tendon. And so you could use your thumbs right next to each other. You could stack one thumb on top of each other. You could switch and do a supported thumb. Is that all feeling okay? Is it getting any better? Okay. and slowly coming out, and then soothing. So for the side lying, treating the adductor longus and brevis, just go right through that gracilis tendon. Lots of soothing. Some of your soothing can just be slow, steady compression, little hand walks with the heels of the hands in those adductors. Nice and gentle. Then you could sink your body weight in. Always wanting to do some nice soothing after working 2 or 3 points in a row. Okay. Great, and now we'll release the adductor longus, excuse me, and now we'll release the adductor longus and brevis on the other side. So, for adductor longus and adductor brevis side lying, the way the anatomy lies now, you pretty much can go right through that gracilis tendon. So I'm palpating it here with my fingers, and notice it's a heavy hand, but I'm not pushing and wiggling, right? I'm sinking in just enough so that I can feel with my fingertips that there's the gracilis tendon. And I'm just coming down off it a little bit. I'm a couple inches down from the pelvis. And then I can anchor right on top of that tendon. So I'm going to get right over top of that gracilis tendon, just a couple inches down from the pubic bone. And my client has indicated with a little nod that I found a very tender spot. So this is going to be the closer to the pelvis that you're more in adductor brevis. And the further down from the pelvis you're more in adductor longus. So this is quite high up and going right through that gracilis tendon. How's that feeling? Okay? Mm-hmm. Do you want a little more or less pressure? A little more. A little more now. So we've been there for a little bit. So I'm just going to move my hand out of the way so you could see right where that thumb is. And then my arm is really straight, and I'm just going to sink straight down a little bit more. Yeah. And we'll just take a couple of breaths here. Nice big breaths in the belly. Letting your bones all get heavy as you exhale. Nice, great. Then I'm going to slowly ease out of that, do some soothing. We went kind of right through that gracilis tendon. We're going to scoot down it just a little bit. You could, if there's not a tender spot through that tendon, you could move just in front of it, just slightly anterior, and you'll probably find your spot right there, just right along that gracilis. So we're going to get the thumb down. You can see here's the spot where I just was. And now I'm down about an inch or so. And I'm going to go right through that tendon again. I'm going to get right over it, sink right down. I'm going to go real slow because it's very tender. That's okay? And so I'm just holding steady. Adductor longus. If you want to engage the muscle, you could begin to lift that right inner thigh up toward the ceiling just a little bit. It's going to push right into me, yep. And then relax back down. You can feel the gracilis tendon is a little bit right behind where my thumb is right now, right? So you can lift that back up a little bit, push into it, and then lower it back down. Maybe one more time. Start to lift, yep. And lower it back down. That should feel a lot better now, yeah. So remembering that movement, that engagement of the muscle helps to spread the tension back into tone in the muscle. and can help to really shut off those trigger points and disperse some of that tension. Okay, so that was adductor brevis and adductor longus, second side with the client side lying. So now we're going to treat adductor magnus. It's really a muscle that must be worked side lying. Face up, you just can't really access it because it lives in this back quadrant here. It's posterior medial quadrant. So it's flanked by gracilis on this side, on the very medial line, and then in the back line, it's flanked by the hamstrings. And so then this line right here is adductor magnus. And I love to take a soft fist and sink in first, and then glide. Does that feel really good? Mm-hmm. Yeah, feels really good. And so you could just do that soft fist glide a few times. What that also does is helps to separate the adductor magnus from the hamstrings a little bit. It gets a little sticky with the hamstrings because the hamstrings kind of lay over it and attach right next to it up at the ischial tuberosity. So our adductor magnus loves those nice, long, kind of deep glides. Still feels good? Mm-hmm. Yeah, still feels good. And, trigger point work is nothing without soothing and warming practices done alongside the trigger point releases. Is that okay? Did it get a little too deep there for a moment? No? Okay, great. So now to find our landmarks, we have gracilis is up here and comes down. So right in this little pocket behind gracilis, and then if we come back now, we start getting into hamstrings back here. So again, there's a little kind of valley, and if you sink into that area just below the pelvis, you start to feel the thickness of the adductor magnus. So I'm going to get real specific. I'm going to stack a thumb, one on top of the other. Okay, and just so that you can see, I'm just going to do one thumb right now. I want to get my arm straight up and down right over that adductor magnus, and I'm going to sink straight down. Is that okay? Mm-hmm. Is it exciting? It is. It's very exciting, right? Again, often a point a lot of folks haven't had touched before, so it can be real sensitive. So that slow sinking is really helpful in letting the body know that you're going to take care of it and not shock it. We're trying to move slowly and move with the body. That feels like it softened up a little bit. Does that feel okay? So here I am right behind that gracilis is right up here. I get right behind it and I'm right up at the pelvis because this point is right up at the attachment. So now I'm going to move just behind that point. So I've moved just behind the point where I just was, literally a half an inch, and I angle down again. Little less, yep. Does that feel better? Mm-hmm. So grateful to my client for telling me she wanted a little less pressure. I don't want her leaving here hurting. Okay. How's that feel? It feels like it's softening it yet? Yes. Mm-hmm. And sometimes it doesn't feel like it's softening yet. Sometimes this muscle has been holding tension for a very, very long time. Any muscle could be stuck in that holding pattern for a very, very long time. So it's fine to give it a little bit more space, a little bit more time, a little bit more breath. Encouraging your clients always when you're working in real tender spots to Just take deep breaths in the belly. Keep relaxing your body down toward the table every exhale. Nice. See how that helped that just release right there a little bit more? Great. And then we're going to glide down and do some soothing. After you do 2 or 3 points, doing some soothing through that length of the muscle and just giving the nervous system a little break from the real specific intensity that trigger point release can feel like. Okay. So there's those 2 points that are right up by the ischial tuberosity. And then if we move down just about an inch, now here it gets a little trickier because the femur is deep down in there. So we've got to have something to trap the tissue against. Here we're kind of trapping against even a little bit the hamstrings as they're attaching up into that ischial tuberosity. So here we might have to play with the angle. We come down about an inch or so. And instead of getting on top and going straight down to the floor, that might work. If it doesn't, you could drop your angle a little bit and angle a little bit more slightly more toward the front of the leg. So play with the angle. Just shift your body, either going straight down. And how's that right there? A little less, yep. Releasing, great. And now this is an adductor. So we could say, Kayla, what you could do is start to lift that left thigh straight up toward the ceiling. You'll feel this muscle engage. Yep. And then drop it back down. And do that a couple more times. Start to lift the thigh up and then drop it back down. And do that one more time. And drop it back down. And how's that pressure feeling now? How's it feeling? Much better. Okay, great. Sometimes when I'm working with adductor magnus, I can really feel I can feel it shifting, and the client will sometimes feel a reference up to the outer hip, up to the glutes, because that adductor magnus has the strongest pull on the glutes of any of the inner thigh muscles, any of the adductors. So sometimes when folks come in, they're having problems with the hips and the glutes, they can feel as I'm releasing adductor magnus with them that kind of stirs up the glute or the hip issues that they're having. They can, I can feel that connection, you know. So here I am sliding up that adductor magnus. And we're going to do a soft fist back down, angling a little bit toward the femur there. Feels smoother to me. Does it feel better now as I'm going down? Feel a little less tender maybe? Okay. Nice. Okay. Adductor magnus. And now we're going to treat, have her turn over, and we'll treat the other side. Remembering that our adductor magnus fills that kind of back pocket in between gracilis and hamstrings. We can lay our knuckles in there, soft fist, and slowly gliding down. I tend to do adductor magnus as the last of my adductor muscles in the treatment because it's the deepest layer. And I like to work superficial to deep, just slowly moving through the layers, doing lots of nice warm-up, lots of soothing after, maybe some compression. You know, my hand that isn't working is always working. And what I mean by that is that this hand is doing what I need to get done right now, which is soothing the adductor magnus and getting it ready for treatment. The other hand might just be doing a lighter glide in the calves. It might be doing a glide on the other leg, or just a heavy compression, maybe even a little compression in that outer hip on the other side. But both hands are participating throughout the whole treatment. Okay, and then we kind of get behind that adductor magnus, kind of push it up toward the femur there. Great. So we're remembering that our adductor magnus begins way up at the ischial tuberosity. So a lot of folks will think that they're having that hamstring issue, but it really might be adductor magnus. So we have to get in really close up. We're near the center of this pelvic line right here. Oh, too much. Okay, we're near the center of this pelvic line. We're right behind where that gracilis tendon attaches, and we get right behind there and sink kind of straight down toward the sitting bone. And often very tender right there, okay? And so again, my other hand might just be doing some soothing or holding, just helping her nervous system to receive this work. Nice, feels like it just shifted right there. And Kayla, would you like to bring a little engagement by lifting that right leg up toward the sky a little bit? Yep, and right back down. And do it again, start to lift. Ooh, it's so hard, and right back down. And so you might not even be able to see her lift, and that's fine. It's just enough engagement of the muscle so that it's actually pushing into my thumb. So we'll do that one more time. Start to lift the leg, push into it a little bit, and then right back down. Yep. Great. Does that feel better, that spot? Yep. So now I'm going to move back a little bit toward the posterior, angle in. Tender there? Yeah. Is this one more tender than the last spot? Yeah, often this more posterior spot, I don't know if it's because it gets a little more entangled toward the hamstrings, but often this second spot that's slightly posterior gets in there and feels a little more intense. And taking another big breath in your belly. Exhaling your whole body heavy to the earth. Right. And move off that. And soothe and slide. Keep soothing. That muscle goes almost to the knee. I want to glide all the way down sometimes. Okay. And I might even get some fingertips and kind of trap it, press it up toward the femur. Does that feel good? Feels okay? Okay. So then now for our next spot, we just move down the adductor magnus a little bit further. And so if I'm up here, gracilis, I'm in this pocket in between gracilis and the hamstrings, And I want to come down just a couple inches from where those other spots were up at the sitting bone. Yeah, it's already tender? Okay. And trapping it against the femur. So my angle's not quite as straight down as it was. It's close, but instead of just going straight down, it's angled slightly toward the front. So that helps it to press against the femur. So we actually have something to trap the point against. And how's that feeling? Good. Mm-hmm. And yeah, great. And let that whole right thigh get really heavy. The right femur, almost like it's made of iron, just really heavy and sinking down into the table. Mm-hmm. Okay. Doing our soothing compression, gliding down. Kayla, is there another spot down this line that you want me to stop at?
I think most of the spots I feel are higher up.
Yeah, it's higher up, right? Yep. Okay. And we'll just check and see. Gliding down. Nice and slow.
Yeah, right there.
Right here, yeah. I thought there was something else going on in there. And I thought there was something else because it just still felt a little chunky, a little kind of thick in this area. So let me just give it a little attention, a little pressure. Putting my knee on the table just to support my body so I can lean in a little bit more. How's that feeling?
It's already feeling better.
It's already better, right? Mm-hmm. Okay. Great. Always doing our soothing, following the length of the muscle. Okay. All right, and that is our treating adductor magnus, second side.